The most important outcome of the passage of this legislation is that for the first time the federal government has made a commitment to providing universal coverage. So that commitment and what I hope will be continued evolution of programs to provide financial access to care and some measure of equity in that financial access, that is really the most important outcome here. I think the thing to be most concerned about at the moment is the potential challenges to the central premise of it, that is, that the federal government should provide equitable financial access to health care. Obviously, there are a number of stakeholders who see this legislation as a threat, and we've already seen, of course, in the last week or so, challenges to the legal basis of the legislation. So I think we need to get through those challenges. The thing that I would change is the introduction of the subsidies and access to new coverage for low-income folks. These are all part of the bill. Not all the details have been worked out in terms of how deep some of those subsidies will go, but the timing of the provision of subsidies for new coverage is such that it'll be several years before we see a practical effect on the uninsured. So I would say if I could change anything, I'd have much more substantial subsidies available sooner. If Massachusetts experience is any indication, and I believe it is, the most critical implementation issue we'll be dealing with in 5 years will be cost control. I believe that many of the issues around implementation of coverage access, such as the design of health insurance exchanges, the working pieces of the subsidies and the markets that will be put into place from the legislation, a lot of that will have been worked through in 5 years. But just like Medicare, every year we will be in a situation, I imagine, of crisis, in effect, because of the affordability issues. This legislation is critical, but it doesn't address the fundamental drivers of healthcare costs. And those will, if anything, be even more important 5 years from now. So I do believe that will be the big issue that we'll be talking about.